This presentation is going to discuss the bony landmarks of the thigh and the hip, as well as the bursa and the ligaments. And we also have to have an understanding of the nerves that are supplied in the hip and thigh as well. Repeat after me, acetabulum. This is the name of the cavity where the hip bone, the ball and socket joint, fits into the hips. It's the hollow that the femur sits in. ASIS is a short version for the anterior superior iliac spine. So this refers to the pelvic girdle and refers to the iliac spine of the pelvic girdle. So if something attaches to the anterior superior iliac spine, then we know it's in the front, it's at the top, and it's on that iliac spine. Whereas AIIS refers to the anterior inferior iliac spine. So that means that it attaches, yes, anteriorly again, to the same area, but inferiorly, so below. Iliac crest is the name of the top of that ridge. So the top of the ridge is known as the iliac crest. The iliac spine is just below that on the inside. And the pubic tubercles are projections that are found on the pubic bone where tendons attach. So a tubercle is a rounded piece of bone where the tendons attach to that bone. The femoroacetabular is where the femur and the hip join. So that's known as femoroacetabular. Can't even say it myself. Femoroacetabular joint. The sacroiliac joint is where the sacrum and the ilium join. So that very fine line where the sacrum and the iliac bone join together. PSIS is a term given to the posterior superior iliac spine. So whereas some muscles attach to the ASIS, some attach to the PSIS. So this is the posterior superior iliac spine. So we're going to have a look at the hip and thigh, and we're going to discuss the ischial tuberosity. Now, this is a better picture of the head of femur for us, but it doesn't show the ischial tuberosity. But the ischial tuberosity can be seen on the picture before this. And your ischial tuberosity is your sit bone. So if you look at the picture before this, the two loops that hang down at the back of the pelvis, that is the ischial tuberosity. So if you've ever ridden a bicycle and your hip bones start rubbing on the seat, that's what you can feel when you're really saddle sore. That's your ischial tuberosity, so also known as your sit bone. The greater trochanter is the largest of the bony prominences of the femur. So a trochanter is only to be found on a femur, and you get a lesser trochanter, which is the larger prominence. And then you get the lesser trochanter, which is the smaller prominence of the femur. There is actually sometimes in some people they have a third trochanter, which I've included in this picture. It's on the right hand side. Some people have a little bump there called the third trochanter, but it's not really in your syllabus. That is for information only, just for background knowledge. And the shaft of the femur then is the body of the femur that comes up towards the head of the femur, which is the ball and socket joint. So the bursas of the hip are the superficial trochanteric bursa, which sits beneath the tensor fasciae lata. So if you remember from your massage course, the tensor fasciae lata comes from the top of the pelvic girdle down the lateral side of the body onto the head of femur. So this bursa sits below the tensor fasciae lata. So repeat after me: superficial trochanteric bursa, tensor fasciae lata, deep trochanteric, ischial bursa. So the deeper trochanteric bursa sits between the gluteus medius tendon and the posterior greater trochanter, so the back of the greater trochanter. The ischial bursa sits between the gluteus maximus and the ischial tuberosity. And here we can see the ischial gluteal bursa, and that's sitting on those loops I was talking about, which are the ischial tuberosity, the sit bone. Discussing the ligaments now. Iliofemoral ligament, pubofemoral ligament, ischio-femoral ligament, the ligamentum teres. So we have 4 ligaments that we need to know of the hip. The ligamentum teres is the head of femur to the acetabulum. That one runs, and it runs along the inside of the acetabulum. The ligamentum teres, the transverse ligament, and the labrum. All 3, their job is to protect and strengthen the connection between the femur and the acetabulum. Obviously, as you can imagine, this bone needs to be held into the socket for the head of the femur to fit into. So the ball of the head of femur needs to sit in the socket. And in that socket, we have the labrum, which is the sort of inside capsule layer of the acetabulum. We have the ligamentum teres, which is the name of the ligament that attaches the femur head to the acetabulum. Teres tends to mean smooth and fine. So they are smooth and fine ligaments or muscles when they have teres in them. Then we have the transverse ligament, which is an extension of the labrum and also assists in strengthening and protecting the head of femur, sitting in that hollow cavity and protecting it. The sciatic nerve is the longest and largest nerve in the body and comes out of lumbar 4 to sacrum 3 of the spine. It stimulates the posterior thigh muscles to work, the hamstrings like the adductors and adductor magnus in particular. Indirectly, it innervates all the muscles of the legs and the foot to work. So has a very big job, the sciatic nerve. It comes out from L4 to S3, but sometimes it goes underneath the piriformis muscle, sometimes it goes through the middle of it, sometimes the muscle loops round the sciatic nerve. So quite often sciatica, which is a pain in the sciatic nerve, is diagnosed, which is really the piriformis syndrome, because the piriformis muscle contracts and causes pain and presses on the sciatic nerve. So the two are very difficult to diagnose. Most sciatica, in my experience, has been alleviated when you relax the piriformis muscle. So you feel pain with sciatica in that tingling that goes down the back of the leg to the heel. Alternatively, the femoral nerve comes out of L2 to L4, and the femoral nerve runs down the front of the leg. So from the anterior hip flexors, the pectineus, the iliacus, and the sartorius are what are fed by the femoral nerve, and also the quads, so which help to extend the knee. So anterior hip flexors and the quads are stimulated by the femoral nerve, which runs down the front of the leg. The obturator nerve comes from L2 to L4 as well, and this stimulates the action of the medial thigh muscles. So obturator externus, the adductors, and the gracilis. So we need to know where the femoral nerves, the obturator nerve, and the sciatic nerve originate. So the sciatic nerve is L4 to S3, and the femoral nerve is L2 to L4, and the obturator nerve is L2 to L4 as well.